Good morning, everybody. Thank you for joining us. My name is Christopher Linlogue. I'm the Senior Manager for the Strategic Partnerships team at the Mayor's Office of Community Mental Health. So, welcome you all to our workshop this morning, our panel discussion, uh, part of a three-part series. We're happy to be partnering with the JED Foundation on a three-part series, Fostering Emotional Well-Being Through Parenthood. So, today's workshop will focus on employer opportunities to promote parent mental health. So we have a great set of panelists, a great moderator, and we're going to provide some great information for you all and your organizations. So we're just going to allow a couple people to enter. I do want to let everyone know that this panel discussion is being recorded because we want to be able to share this to people who may not have been able to attend. So if you do feel uncomfortable with it being recorded, you have the option to turn your camera off so you won't be seen, or if you feel extremely uncomfortable, you will leave us if that is the case. But either way, you'll be able to view this recording at a future time and be able to share it with other members of your organization. So we're just gonna probably allow one more minute or so or less for members to join and we'll get started. All right, so I think we're going to get started because we do have a jam-packed panel. So we want to make sure we get to all the information. Again, this is the first workshop in a three-part series and fostering emotional well-being through parenthood. All right. So as I mentioned, I'm from the Mayor's Office of Community Mental Health, which is a citywide effort to promote mental health for all New Yorkers. We partner with various city agencies and many nonprofits to provide mental health programming for all New Yorkers, regardless of their insurance status, their documentation status, their ability to pay, so on and so forth. And so one of the things that our unit, Strategic Partnerships, does is we try to identify other organizations that we can partner with to provide mental health information, content, or programming. So we're very happy to partner with the JED Foundation, which is a nonprofit organization that protects emotional health and prevents suicide for teens and young adults in the United States. They partner with many high schools and colleges throughout the nation to strengthen mental health, substance misuse, and suicide prevention programming and systems. And so they have been gracious enough to partner with us on this three-part series. Again, this is the first workshop. We have one next week and one the following week. I will get to that. So our presentation today is about employers and what they can do to support the mental health and well-being of parents. All right. And so this is very important to us. One thing that we believe is that the workplace can be used to activate and support mental health, right? Many of us get our health insurance through our employers, which is a venue for us to receive mental health care, right? But we oftentimes spend a lot of time at our workplaces. And so we want to make sure that workplaces are supportive environments that promote mental health. When employers and in workplaces are able to do so, they see a benefit, right? And so we know that for every $1 that is invested in prevention and treatment programming, it provides a 4% return on that, $4 return on that investment, right? So that's something like 300%. So as long as when employers and organizations work preventatively to support the emotional well-being and mental health of their employees, it leads to great results on the other end. All right. Now, in terms of parents, why are we highlighting parents? Well, parents make up a large share of the workforce, right? These are some data points from 2020, right? The most recent Bureau of Labor report that showcases that 88.5% of families with a child under age 18 has at least one parent working. All right. And so 71.2% of women with a child under 18 are working full time or working some portion of the time, whether that be part time or full time, and 92.3% of men. So what this shows is that there are a lot of parents in the US that are working. And so there's a strong chance that your organization employs many parents, right? And so parents are, people, they are employees, they have unique stressors that relate to parenting and being a parent at a job. We have some parents on our panel who will talk about what that stress is like and what those stressors might be. Now, when we support parents at the workplace, just like when we support other individuals, it provides benefits for the organization and for that individual, right? We always want to make sure that we increase employee satisfaction and productivity. And that can happen when people feel supported at work and they feel like if they are running into challenges, mental health or otherwise, that their employer supports them, right? And when they are satisfied, they potentially will stay longer, right? And they potentially will work and be more productive, which is good for the organization, but also good for the individual, right? Because we all want to be productive, right? As an organization, if you support parents and other employees, you can attract top talent to your organization, right? We all are recruiting and we all want to ensure that we have the highest quality of staff available, right? And so if we are a supportive environment, then maybe that attracts some top level talent. We mentioned the retaining of quality employees. If the workplace environment is supportive, if I'm a parent and I feel like my supervisor and my organization understands the struggles and challenges that I face, and I feel supported, then I'm more inclined to stay with this organization. If I don't feel like I'm supported, then I'm going to be looking for an organization that will support me. All right. And of course, we always want to increase diversity among staff, right? If we take care of our parents, then that helps us diversify the workforce because we can say, hey, we employ parents. We also employ caregivers, or we employ more women who may be the primary caregiver in the family, whatever the situation is. We make sure that we ensure that we have a diverse staff, and diversity is important, right? Because the more voices we have in the room, the better our products are, right? So real quickly, we're going to get into an in-depth panel conversation about different things that employers can do. But I wanted to highlight a couple ways that employers would be able to support parents, right? Of course, there are policy initiatives that can be supportive to parents. Equitable pay, right? As we noted, there are women who historically have been considered primary caregivers, but also historically have not been paid in the same rate that they should, right? And so equitable pay is an extreme policy, is a excellent policy measure to ensure that all people in your organization are getting paid the amount of money that they need, right? Paid family leave, a big thing. The U.S. is one of the only countries, one of the major countries in the world that does not have a legal paid family leave policy. There are several states that do, New York being one of them, right? But as a country, that is not something that we have. So it's on organizations to put this policy in place to support parents, right? Childcare and subsidies for childcare. Some organizations have the ability to have childcare on site. Other organizations provide subsidies to assist parents with paying for childcare services, right? This is, again, a policy initiative. Flexible schedules, work from home options. We've seen this in the pandemic as many organizations had to go remote. This is something that is of a great benefit to parents, right? Because there are things that you have to do throughout the day, drop your kids off at school, pick them up, doctor's appointments, miscellaneous things, right? And so having the ability to flex the schedule, very important. Benefits plans oftentimes cover employees, right? But maybe we can extend some of those benefits to cover not only the employee, but other family members, including children as well. All right. And that's beyond just the healthcare plan. This could be the EAP plan. Some EAP plans allow for coverage to a partner or spouse. Some may even extend to children or other family members, right? So again, a policy initiative. Lactation support, new mothers who are lactating and returning to the workforce, they should have the ability to do that at different times of the day whenever they may need to, right? And this may require a policy initiative. I know we work for the city, and that's something that the city has been working towards, making all spaces accessible for lactation. And Deb may be able to speak about that. And of course, there's programming, right? And you're going to hear a lot about innovative programs from our great panelists, but it could be employee resource groups, parents, right? Ways for parents to get together, share resources, exchange, build relationships, talk about what it's like being a parent at this particular organization, right? And, oh, my kid went through this. Oh, okay, my kid also went through that. These are the resources that I use, right? Could be a great opportunity for programs. There's other peer support opportunities that you might create. Mentorship programs. There could be people existing in your organization who have been parents, and maybe they can be a mentor to new parents or other parents within the organization, creating that bond. And so helping guide that person through the challenges that they may encounter. And of course, there's capacity building and educational efforts that can be done. And that can be related to parent related topics. Okay, your kid is about to start school. Here are some things that you should look out for. And it could just be related to other things, stress management, right? How can you prioritize or organize your schedule in a way that allows you more time. All these different types of capacity building opportunities just allow parents and other employees to gain skills that can be useful at helping reduce the stress that they may encounter. All right. And so these, of course, lightly, I went over these things because I'm going to leave it to the panel who are distinguished experts who will speak more about it. So I'm going to turn it over to Dr. Nance Roy, our partner from the JED Foundation. She's the Chief Clinical Officer there. So she will speak more about her background, and then we will get into the panelists as well. Oh, that's not a background, Ian. I see somebody in the back cleaning. Nice. So I will turn it over to Nance and stop sharing these slides.
Thanks, Chris. Thanks for the overview and the introduction to our topic today. I am very happy to be here with these distinguished panelists who will have lots of great gems and words of advice, thinking about opportunities that you can consider for your parents who are employees of your organizations. I will just briefly say, as Chris mentioned, I am the Chief Clinical Officer at the JED Foundation. And as he mentioned, we are a nonprofit that works to promote positive mental health among teens and young adults toward the ends of reducing suicide and substance misuse. And one point I will just highlight, Chris, as you mentioned in your opening, that increased productivity and the like is such a payoff when we invest in prevention in organizations. And I will say our experience in school systems is the same, that when colleges, universities, high schools invest in mental health of their students, we see higher graduation rates, fewer leaves of absence, income generation potential, so many benefits that come along with promoting positive mental health. So with that, let's turn our attention to the topic of the day. And maybe the first thing we can talk about is, what are some of the unique stressors that you all as panelists are seeing for parents in the workplace? And Deb, maybe we'll start with you as both a parent and someone who supports parents in the workplace. Let's start with you to see if you could speak from both ends.
Sure. So thank you all for being here and for the opportunity to participate. My name is Deborah Friedman. I'm Assistant Commissioner for Workforce Engagement and Innovation at the New York City Mayor's Office of Labor Relations, a mouthful. And I oversee our Worksite Wellness Program, which is relatively new to the city of New York, and work closely with our health insurance program. I am also the mother of 19-year-old twin girls. So I have a lot of experience working full-time as a single mom to 19-year-old girls. And as somebody a long time ago said to me, being a parent is a full-time job. And so effectively for 19 years, I've had two full-time jobs. The first one I got paid for, and the other one cost me a bundle as a parent. And so, but part of the challenge is that my parent responsibilities don't end before I show up at work and just after work. It's all the time. So, a piece of my brain is always dedicated to, what are my kids doing? Did my babysitter come? Are they well enough to go to school? Is there a parent-teacher conference that I'm supposed to go to? Did they get their homework done? Did they remember to bring their lunch? Am I running late because a teacher grabs me as I'm doing drop-off and now I'm going to be late for my 9 o'clock meeting? So for many years, I felt like, that person in the circus who balances the plates on those spinning wheels, and I was constantly spinning. And it was incredibly, incredibly stressful. Then as they got older and they were more independent, there was a different kind of stress, more focused on, what are they doing? Who are they doing it with? Where are they? Are they actively engaged in something that's constructive? And so, and then there's the whole financial part, right? How am I saving for 2 kids to go to college? How am I paying for after school activities, for summer programs? I didn't have, because all of my family works, so I didn't have somebody I can count on to come and take care. So I think that I think as parents, we're pulled in multiple directions. And I was very graced with healthy kids. And then you have kids who have, special needs, which adds a whole other layer of challenge. And I think in COVID, many of us spent a lot more time with our children, 24 hours a day, for those of us who are able to work from home. And so we have a whole new experience of who are our kids, what are their needs, how they benefited with us being around so much. And so lots of folks are feeling stressed now that in the city, we're back in the office full time since September. And how do we continue to be there for our kids? And it's real stressful for them. I mean, kids are real scared. And I have colleagues who's really struggling with how they can be present for their children, present for their job when those two things interfere.
Thank you, Deb. That's very helpful to get a perspective as a parent. One of the things that you mentioned about being home with children, if you have them at home during the pandemic, has certainly brought to the foreground the many issues that we're seeing, not only for students being at home, but especially for working parents who are having to juggle both being full-time at home, schooling their children if they're young, at the same time needing to juggle their own work and self-care, which is usually the last thing on the list and the first thing to go. So thank you for sharing that experience. And I'm wondering, and actually, Michelle, maybe you could speak to this or begin to speak to this. And thank you, by the way, Deborah, for introducing yourself. If each of you could do that at the outset, that would be wonderful. But I'm wondering, after listening to what Deborah, noted as some of the challenges and stressors that parents undergo, how do employers know about that? How do they get that information and understand the challenges that parents are experiencing at work?
Yeah, thank you. Michelle Martin with Viacom CBS. I'm Senior Vice President of the Total Rewards Experience. So I manage benefits programs, policy, workplace well-being programs. And we find out through various ways. We do company surveys, so we will get information back in surveys from employees about specific things. But I have to say, most recently, it's really people just coming to us. They get to know us. We do monthly webinars, so they see our faces, and they will come to me or people on our team and tell us, what they need, what's working, what's not working. Another opportunity to get feedback has been we use Slack. So any of those company-specific social types of programs, we get posts on our Slack, and some are just great ideas, we'll run with. We're like, wow, we never thought of that. Thanks. And then you start to see what people are struggling with and supporting each other. I know earlier it was mentioned like employee resource groups. That's a great way to get feedback to our department. So we have a parents group. They'll get together. They talk about things. They bring what they want to see to us, and also feedback on a lot of the programs we offer. So we know what's valuable and maybe what we thought was great, but really isn't, helping as much as we thought it would have.
Great. And so, we've heard from Deborah about what are the stressors that, she in fact has faced as a parent. And I'm wondering, both Ian and Michelle, if you can also speak to what you've learned from those surveys or from the information that you've gathered. What are some of the top stressors that you've learned that parents are struggling with?
I can start. The cost of childcare definitely comes up as a top concern, and our company even offers subsidized backup childcare and other programs, but it still comes up as a top concern. And something more recently, and I'd say it's probably due to a lot of the work from home for the pandemic, is trying to not let other people see maybe the stress. Now we're on camera in everybody's home, and the stress of like the people juggling, like they don't want you to see them juggling everything. Like you're supposed to be focused 100% of the time on work. And we've come out that that's not possible, right? Like, you know, we understand that. And your kids are there, and it's very hard to explain to your kids that, you know what, I'm sitting right here, but I'm actually working. So I think those are probably some of the newer issues that we're seeing coming up and trying to address as a company through our managers.
Great.
Yeah, just to follow up on that, you know, we're hearing a lot of the same. I mean, it's really leading with affordability. And then after that, access. Where do I find childcare? Especially childcare that, you know, is affordable. We're very mindful in the work that we do at EDC, really making sure that we're creating good jobs for New Yorkers, jobs that will lift folks from lower income class to the middle class, and making sure that those individuals who are most vulnerable, right, are accessing or at least aware of and knowledgeable of where they can get access to resources. And so that for that reason, we actually recently launched the Child Care Innovation Lab at New York City Economic Development Corporation. So part of our Women.NYC portfolio. And this program is meant to be a forum through which we can start to develop and design policy and work with employers directly to help them really think through, really sit as thought partners and think through creatively, what can we do to expand on the options that we're making available to our workforce, to our parents, to our caregivers. You know, after that, the thing that we're hearing and that I've seen most commonly, even before my time with EDC, my time at Fountain House and my time at the mayor's office, you speak to many folks in ERGs and they'll say that it's through the ERG where they have the most secure and comfortable forum to really disclose and have a really robust, full conversation about, you know, what they're dealing with as parents, especially when it pertains to mental health. But in that same breath, you'll be told very commonly that as an individual, and I'm bringing this up because Michelle, you talked about surveys, and it's very interesting when the survey comes around, how skeptical individuals are in filling out that survey fully and honestly, because there's this perception that, you know, hey, Big Brother's trying to weed out the weak links here. And that's truly not the case, at least based on conversations that I've had with employers who are really trying to do everything they can to build trust across their workforce so that they can bring in the resources that are needed, so they can have the data to make the use case, right, and to prove to senior leadership, the chief executive office, right, to say, hey, look, we need the budget for this. We need to have more resources available. I know Viacom people that work, I know some folks that work there personally, and I really love the fact that like once a month, and I'm not sure if this still happens, but once a month, you have a talk therapist that comes in and is made available to folks to be able to actually schedule, feels like office hours in terms of the format, but they can come in and be able to on site have that forum and an opportunity to speak with somebody and speak to a therapist to address their mental health. So I think those are the major issues: access, affordability, and then trust amongst the workforce to really have an honest conversation as individuals and not having to rely on scale and numbers to do so.
Can I just add something in there? I mean, obviously the city has a very large unionized workforce. Over 95% of our workers are in a labor union, and I'm not sure how many others on the call have a unionized workforce, but partnering with the unions can be a very important way of gathering information through a trusted source, but it's also pushing out information through a trusted source. So I would consider looking to your union colleagues, and I spent 30 years in the labor movement before coming to the city, working in a joint labor management arena where we had a lot of really innovative childcare programs that we can talk about later.
Actually, that you read my mind, Deborah, because that was the next question I was going to move to. You've all sort of hinted at some innovations that are going on and innovative programs that your companies and your organizations are either employing themselves or promoting as good recommendations. And I'm wondering, I have actually a specific question back to you, Ian, about trust and developing a sense of trust and people feeling safe to talk about a mental health challenge. And I'm wondering if any of you have programs or know of programs where organizations are training their managers in terms of how to be good mentors, how to be supportive of mental health, how to ask the right questions, how to give the right responses when someone may bring up a mental health concern. So I'm wondering about those kinds of educational opportunities for management, as well as any other innovative programs that you may know of or you may implement. So Ian, why don't we start with you?
Sure. And I realized I forgot rule number one, introduce myself. Ian Straughter. I am the Assistant Vice President for Workforce Development Partnerships at New York City Economic Development Corporation. But to answer your question, and I'm going to kind of pull from my previous experience before EDC, from the time that I spent working at Fountain House. In the programs and the way that we went about really working with employers directly to help educate them and really understand, the importance of being able to speak about mental health in the workplace. For us at Fountain House, we had an interesting model. They still do have this model where their clients, who they fondly call members, they are involved in the day-to-day work. So a lot of the times where I'm walking into a company and I'm convincing them to partner with Fountain House and develop an employer partnership, hire some folks, I usually would have a member with me. There's also moments where we really engage employers because, many of you are here, this, you get a call from someone like me, says, hey, look, hire some of our folks. It's not always a yes. There's some time that it takes to build that relationship. And so one of the things that we really did well during my time there was develop an advisory group where we'd be able to bring employers into the room to work in partnership with members of Fountain House to help us think through things like how are we designing or redesigning our employment program? How are we looking at employers to partner with? This moment is important. This direct interfacing with individuals who themselves are dealing with mental health challenges and have been diagnosed with severe and persistent mental illness. It's a moment to bust stigma, right, with the employer, so they can understand that, wow, it's not as bad as I thought. This isn't the risk that I thought it would be in terms of hiring this individual. But most importantly, and what more commonly happens is I get pulled aside and I'm told about the 1, 2, or 3 family members that 3 out of every 4 people in that room, and that statistic holds true in any room I'm in, that have a mental illness or mental health challenge. And it's through that work that we're able to really start to cultivate and develop champions in the workplace. So these experiences are brought back into their respective workplaces. And through that work, we're able to engage their colleagues, their coworkers, to really help design more robust programming, but really leaning on and leading with opportunities to volunteer and mentor others who have enough courage to be vulnerable and transparent and put themselves out there, not only on behalf of the organization that's serving them and representing them, but really doing so with someone that they in the future would like to work for.
Mm-hmm. Thank you. Michelle, I was reading a little bit more about your background, and one of the things you're in charge of is happiness of employees, which I thought was just a wonderful job. And wondering, as you think about parents in particular, what are some of the innovative things that you are doing at your organization at CBS and Viacom around happiness for parents?
Yeah, and this is one category that usually, especially with new parents, you can have some fun with. It's a happy time, as we look at different types of caregiving, we have to look at things differently. So this is usually a happy one, but it certainly does bring a lot of stress for the reasons that Deb and others mentioned. So innovative programs. We have an infant transition program. So in the first year with having the baby, you can use up to 30 days of backup care as you come back to the workplace. So it's a very small copay, so very small copay that employees pay, that Viacom CBS pays the majority of this program, but you can get childcare up to 30 days in that first year. So if you're just taking time to kind of come back to work a couple days a week, you can use it. You can use it as, time comes up, and a lot of time the parents are splitting their parental leave and other paid times off programs. So that's something nice that we like. And backup care was or the need for care that's unexpected when your regular caregiver leaves, that did come up as one of the #1 sources of stress on a recent survey for us. We do several things. So for like teens, we're piloting a program with one of our vendors, Ginger. It's a text-based emotional health program. And we have a pilot out there now for teens, for the ages 13 to 17. And that is a category where I feel that there's a lot of help that's needed for parents in those age groups. So we're excited about that being out there now. The employee resource group, the parents group, is really a good one. We also do tutoring now. That started after the pandemic. So employees can use a certain amount of hours for virtual tutoring, and that goes up to age 18. So they can even use it for like college prep, or just, you know, if you need activities to keep your kids as they were going through virtual learning. And that, I think, we are going to keep beyond pandemic. So that was a nice thing that came out of that. Some of the other things, you know, we say that it's a happy time for most, but sometimes it's not so happy. We do have pregnancy loss is covered under our bereavement leave. So when that happens, employees can get paid time off if they lose a pregnancy. We include a lot of, and that's kind of mixed in there, but we do have like robust adoption, foster care. So I'm back to the happy things. We do cover for parental leave. We have a very, I think, generous parental leave, and also caregiving leave. So when you talk about the parents, we do see 12, I think it's 12% on a recent survey that care for a child and an older adult. And so that is a lot on someone. And we also offer a paid caregiving leave, so they can take off 6 weeks paid full pay for caregiving. And our parental leave is a little bit longer. And then I think a lot of what you mentioned at the beginning, we also do. So the lactation rooms, we do milk shipment for employees who are traveling. And then I'd say the most important, the key, and it's really not innovative, but it's probably the easiest thing an employer can do, is just be generous with your paid time off. It's mental health, it's caregiving, it's everything employees need. So I think generous paid time off programs are probably like just the first and easiest thing you could do.
Yeah, I have to agree with that, both as a parent, you know, when I had younger children at home, as well as what I think, I forget who it was, I think you, Ian, or Deborah mentioned the flexibility in schedules. When that meeting comes up, or your child's in a play, or, you know, any number of things that always comes up when you have little ones. I'm remembering when I was going on job interviews and my children were still young, and I would inevitably be asked the question, so what are you looking for, you know, in the job? And I would respond by saying, to be home in time for the bus. And that was always my gauge of whether or not this would be a place that I would want to work, you know, if they could join with me in that conversation. And so I'm wondering, as well, as you think about hiring people, and you think especially about hiring parents, you know, how does that come into play at your organization? And is that something, obviously you're not going to discriminate against them, but how do you negotiate that at the outset with a potential new employee?
You know, I would say if you look at our offerings, Viacom CBS is a very family-friendly, family first. So if you look at all the programs that we have supporting parents, I think that's, we actively recruit for it, and we also support parents throughout their journey. An employee recently said they've been with us a long time, and they said, you know, you guys were there from crib to college. Like, you know, from the infant all the way through. We have college coaching programs that help reviews kids' essays as they apply to get into college, you know, and everything in between. So we've really built a lot of what we offer around parents and around family, and being able to support and keeping people in the workplace. And so it's been really, you know, a key focus for us.
And Deborah, maybe you could speak a little bit about the Work Well program and what is included in the Work Well that focuses on parents.
Thank you. So Before I get to work well, I mean, the city of New York, our employees, and there are 380,000 of them, are incredibly lucky because we have a very robust employee assistance program that has many licensed mental health counselors on staff who are available, sort of like what Ian was talking about. And so part of what they have been doing for many years now is being available not only to employees and their spouses, but their dependents as well, including their children, for that confidential support, which is really powerful. They also have run groups for parents and other caregivers so that they can be supportive of one another. They also started some of the supervisory managerial training on how you can be supportive of people in your office. So WorkWell, as the worksite wellness program, has picked up some of the work that EAP is doing to try and broaden it out. So we are developing managerial training for our employees, especially coming after COVID, on how do you have a supportive work site. Again, because it is about parents, it's about caregivers, it's just about dealing with the mental health and stress of coming back. And we've partnered with the Office of Community Mental Health on some of the programs that they've done to try and push that out to city workers. We also have many workers who have experienced secondary trauma that's that much worse now, post-COVID. So looking at parents who are, so employees, but also parents who are dealing with the constant loss of the kids going to school, not going to school, and the stress that puts on their kids. And so how can we offer the parent support to help their children? And so we'll be working with our EAP and the Office of Community Mental Health to help think that through. There was one other question that you had asked me. The other thing that we've been doing, it's not specific to parents, but a way that we've been gathering information and providing support is through these listening sessions. We have this Navigating Change workshop that provides some resources on how do you build resilience within yourself, your family, your coworkers. And so some of it is a didactic training, but more of it is getting people talking to one another. It sort of works off of the peer model that Ian was talking about. And then connecting people so that they don't feel so isolated and alone, which we know has been a big mental health issue this past year,
Yeah.
2-year period.
And we know just nationally that, the Surgeon General has, noted many times loneliness is an epidemic in our country. And we know that loneliness and sense of belonging and connectedness clearly impact mental health for all of us. Parents included, of course. I'm wondering about how you are measuring, if you are, the efficacy of any of your efforts to support parents, and how do you, or what kind of feedback have you gotten from parents about the things that have been the most helpful and the most useful in supporting their mental health and supporting their life, really?
I can tell you something that's hot off the press. So the New York, many of our unions have opted into the New York State Paid Family Leave Program. And we recently partnered with the Center for Parental Leadership to survey the folks who participated in the PFL program over the last 2 years. And it was very interesting what we learned. And unfortunately, what we learned is the culture of many of our organizations are not supportive of people taking time off, either because people didn't have access to correct information, or they felt pressure not to take intermittent leave, or if they did take the leave, all the work just piled up. There was no backup for it. It differed at different agencies, but the overall theme is it's really hard to take advantage of this wonderful program that the employees are paying for themselves. So we're working very closely with our union, one of our larger unions, to figure out how do we change the culture. Not a small thing. supporting the managers, supporting the coworkers, figuring out if there's money to backfill positions, things like that. So we have a big task ahead of us. And how do we help the employees? And the union's going to be working on developing workshops. How do we help employees advocate for themselves and communicate what their needs are? Like you said, I need to be home in time for the bus. How do I set that boundary and have it be supported and accepted?
Michelle or Ian, do either of you have evaluation strategies or feedback strategies that help to inform your efforts? What's working, what's not working?
I could jump in and just say, from where I sit, I typically answer the room kind of putting on my activist hat, right? And helping folks just feeling comfortable socialize things in their respective spaces. But what I will say is most impactful is when you see your leadership doing the things that you'd like to see be done in the workplace. And I'm always grateful for the moment where I see a senior leader being very vulnerable, especially when they maybe didn't even mean to do so, in front of their subordinates, because it empowers those individuals and gives them perspective to understand that, yes, you're not the only one going through this. There are others as well. So just even one example here, just in where I'm at now at EDC, we have some executives who are balancing this issue, and we've seen them on calls walking their children from school, to and from school, right? This is a small signal that helps others around the organization here at EDC who I've spoken with personally and tell me that, hey, I'm afraid to take time off. I'm not sure how to establish these boundaries. I'm not sure how to really advocate for myself. To say, look, this is where the line stops at this time. This is for my family, and I'm just away from work. So I think seeing that leadership really have that lead with that vulnerability is one thing that we should be thinking about in terms of, a way to change culture within the workplace. Also think that, the city has a role to play in terms of the stakeholder engagement, the work that we do to connect with communities externally, right? Deborah, you've done a great job leading our efforts internally for New York City's workforce. In fact, I was on a city line. I'm very grateful for your work because the insurance and the benefits are phenomenally amazing for me as a worker in the city. But for others, they might not necessarily always have that. So I think that's one thing that's important for us as a city, to make sure that we're meeting people where they are and helping them to feel empowered to, come together themselves. Like over in Jamaica, Queens, organization called Many Babies NYC, founded 5 years ago, simply because one individual had such a stressful time understanding how to navigate Department of Education system for her two twins with special needs. Didn't understand all the alphabet soup, what an IEP was, how to talk to an occupational therapist, how to advocate to superintendents or principals for their needs. Started talking to her neighbors and folks in the neighboring housing projects over in the NYCHA houses in her community, and saw that they were experiencing the same things. And now they have a community group where they come together to be able to, really have a peer model to really be able to talk about what they're going through, have that outlet. And then also tactically think about what can they do as activists to advocate collectively for what they need for their kids in the school system. I think that model can be lifted and replicated, if not for advocacy for your children with special needs in the school system, simply for understanding where you can go locally and close to you for the resources that you need as a parent, whether it be a therapist, psychiatrist, or finding affordable and accessible childcare.
That's a great sort of duality that you're talking about, both sort of a grassroots effort among peers advocating as a group for a particular issue, and also your mention of the importance of senior leadership being on board. And we have found ourselves at JED, as we work with schools, for example, that unless the college president or the superintendent of a high school principal, et cetera, if they are not on board, it's very difficult to move the needle and affect any kind of long-term systemic change. So really the importance of having leadership, as you mentioned, not only show their own vulnerabilities, but certainly be champions and advocates for this work at your organization, as well as having the strong and loud voice of the employees themselves in terms of what they need and how they can advocate for themselves. I'm curious if how employers are educating workers, parents and beyond about what is available to them. We've talked today about a lot of great initiatives that hopefully employers who are listening can begin to put into place for their parent employees and other employees as well. But how would I know about it if I'm an employee? As I've been on college campuses my whole life before coming to JED, and it always used to amaze me that no matter what we did, students would still say, "Oh, we have a counseling center," or "Oh, we have a health center." So I'm curious what efforts you all can recommend or that you've made toward educating parent employees and others about what's available.
I'll start. That is probably the hardest thing for us. So we're a global employer, and getting the word out and getting it out often is important. We use various, so through email, we do at least one big home mailer a year that's not like a compliance enrollment type of mailer. That's just a fun here and pick a topic. We usually send it with a little gift or something, so it helps our open rates a little bit. But then, the Slack channels and those kind of quick updates seem to be working really well. And we've only started using that a lot over the last maybe year and a half, 2 years. But we do like Slack exclusive events. So if like people join the Slack channel, we do like a special event, and it gets our numbers up, and people start to really watch that. And we're able to get timely information out there. I'd say, and we try to be unique. We're not doing a lot of on-site now with COVID, but hopefully soon we'll be getting back to a lot of on-site activities, because those, in addition to the home mailers, they're kind of unique. You don't do them a lot, so when they happen, they get really good engagement. And then word of mouth. It's really, those employee resource groups are amazing. Talking to people and sharing, and leadership was, I think, a great point. We recently did like these manager toolkits. So when they have their staff meetings, they open the meeting with a slide about one of our benefits programs or policies. And so as people are coming into the meeting, they learn about something, that might be timely. And we create those and update them quarterly.
It's great.
Yeah.
Deborah?
Yeah, one of the things that, we're a big bureaucracy, and so we depend on the intranet and the email and looking at policies, which of course nobody does. And even if you look at the policy, you can't read it. So part of what we are talking is really focusing on our HR professionals, especially for new parents, because they will go there because they know that they need to take time and leave, and they can ask. So we're asking our HR professionals to have as a resource all of the family resource programs that are available to them, so that it is at least one funnel spot that you can learn about, the paid family leave or the paid parental leave we have for managers. We have lactation programs. We have, the different insurance opportunities, our employee assistance program, all of those different types of policies and procedures that exist, but to have it in one place, easily identifiable. Because as you said, getting pregnant or about to adopt or foster, there's so many stressors. You're not going to start looking on a website to find all the answers. And also, our union partners can be extremely helpful here.
Deborah, I just want to follow up 1 second, and then I'll go in.
Got it.
You mentioned the HR folks when someone, is going to take a leave or whatever. It's really interesting to think about people get information and receive information when they need it. Because, you're first coming into an orientation, you're going to hear about everything, and none of it's going to stick usually. But when you're at that moment of need, you need to take time off, or you just had a child or whatever it might be. That's an excellent example of in the moment when the need has arisen to make sure they know all of the resources, because that's when people will hear it. And Ian, I'm sorry, I didn't mean to cut you off.
No, it's all right. You're the moderator, it's your show, following your lead. I just wanted to call out though you talked about schools, and that really hit home for me for a number of reasons. Before I forget, a couple mentions. So Department of Education, they have this great team. I'm not sure if they're broadly known, but they administer a portal called Parents University. And I found out about this platform about 6-7 months ago, and they have all types of content up there. It's not just like announcements, hey, report cards are coming out, or there's a field trip that's happening. They're putting fitness classes up on this platform. These panels will be posted there. That's phenomenal. Yeah. So it's a great resource because it sits right on the machines that students are getting at DOE, and every parent has access to it through a login, and hopefully through the success of the rollout of the broadband implementation plan, we'll be able to have much more certainty around those individuals living in communities that might be considered broadband deserts and lacking access to internet, and therefore lacking access to that platform. We'll be able to access that platform there. It's not set up to meet people in the moment where they are. I hope that in future iterations, they'll be able to program it and build it so that it is able to do that, because it is a lot of information to take in at once. But I found it to be a phenomenal resource that not many people that I've socialized this to seem to have heard of. And the other piece about just being even on college campuses. So I'm a university professor myself, and most recently teaching grad school courses, but my first teaching job was with first-year students, and they in particular deal with a unique set of stressors trying to adjust from, a year ago having to ask for permission to use the bathroom to having full license really to make decisions for themselves. And it's stressful to navigate that and to understand, hey, what's a priority and what isn't? What assignment must be done before others? You see everything as a big fire hose coming at you at once. And I've had at least 3 students for every class I've taught. I've taught 6 classes at that level where they've approached me directly. And it's only because the first thing I say in class is we have a counseling and wellness center here. If at any moment you feel overwhelmed by your schoolwork, you should take a walk over there and ask to speak with someone. And the incentive here for folks, a lot of students don't realize this when I say this as well, that you can withdraw and preserve your placement at the university if you go through the counseling and wellness center's process and disclose to them confidentially the issues that you're currently dealing with and the challenges that you're faced with. It's a phenomenal resource. And when I explain that to students and let them know, hey, look, you don't have to fail out. You don't have to put yourself in a position where you're taking on exorbitant debt because you withdrew in the middle of the semester, but you still have to pay for the entire semester. That is such a reprieve. And so I make it a point as a professor and a teacher to walk those individuals to the counseling and wellness center myself, because I find that most other professors and counseling and wellness staffs have told me this directly. They reach out to professors and instructors, and the answer most commonly is, I don't have time. I got to grade papers. I got to manage my classroom. I'm not really thinking about that. But it's the most important, I think, piece to student success. And that's why, I'm really grateful for programs, and I'll shout out Fountain House again, like the college reentry program. That program works directly with families and parents who have children in college who are dealing with a diagnosable mental illness, who are struggling to stay in school, and they help them directly to preserve their spot at the institution, but then enroll them in this program that enables those individuals through a peer model to meet others like them, to know that they're not the only single person dealing with this in their class, but they get to meet 10 to 15 other individuals who are dealing with this as well. And that in and of itself provides a level of empowerment. And that's why we've seen, at least as of 2 years ago when I last checked the numbers and I was close to Fountain House, that we saw 80 to 90% of individuals participating in the program being re-enrolled and successfully completing their studies at the college level. If you're not familiar with them, I highly recommend that folks go check them out.
Thank you. We need to wrap up so that we have a few minutes for questions. I will just add, though, you point out an interesting sort of time, and that is a time of transition. You talked about it in terms of college student life, but think about it as an employee. You're now also a parent. You're transitioning to now becoming both an employee and a parent. And those, those transitional moments in our lives are, key opportunities to offer support. What do you, how do you support your folks that that take time away? How do you support them upon reentry? Those are all interesting questions. Unfortunately, we don't have time to explore today, but I want to turn it back. I want to first thank you, panelists, for very insightful conversation and great recommendations, and turn it back over to Chris to moderate some questions if we have time.
So yes, thank you, panelists. Great information. We appreciate you sharing. I'm just going to share a slide, and we will have some time for questions from the participants. Please throw them in the chat, and we'll try to get to a couple. There are some that came in with registration, which I appreciate. But I appreciate the panelists for everything that they mentioned, all the different types of innovations that they've seen or implemented at their workplaces. Want to talk about some resources that our office have put together to support parents and teens. We have a guide that talks about different resources that are available. So as we mentioned previously, as an HR staff person, as a manager, just as a colleague, it's important to know what resources are available. And so you can definitely, start my video. And then you can, so you can definitely take a look at that. We will send these slides out so you will have access to the links. The second, the toolkit that we have on this slide is the Toolkit for Employers. It's all about workplace mental health, different innovation strategies that you can implement at your workplaces to make it more supportive and friendly, right? Which all parents want, but all employees want as well. So the toolkit has tons of ideas and resources, many of which are free, for things that employers can do to create that supportive environment. And lastly, we also talked about caregivers, right? So not only are people parents, sometimes they are taking care of their young kids or their children, but they also are a caregiver for an older adult or family member, right? And so it's important for us to pay attention to them as well. So our office developed a guide that showcases resources for caregivers and how to support their mental health as a caregiver, all right? So I know the questions are coming in. Real quickly, I just want to speak about, again, this is part of a three-part series, and I heard a shout out to Parent University. We are partnering with them to host these workshops on their platform, but our next scheduled session will be talking about promoting your mental health as a parent. So what can parents do to maintain their mental health and support their mental health and that of their other fellow parents? So we have another great set of panelists that will speak about that, all of whom are parents. And then lastly, we're going to talk about supporting your teens' mental health. So we had some conversation about our young people, our teens, either in high school and preparing for college or going to college. So our last session will be a conversation with teens about the things that they have been able to do to support themselves and what they would like parents to do. So all of us parents on the call who are looking for ways to support our teens, please check into that one with your young person as well. All right, so I'm going to, and that QR code will be the RSVP link, which is also in the chat. So I'm going to stop sharing, take a look and see if we have any questions. I know one came in that I kind of want to ask real quickly. Oh, we're hitting 12:30. All right. Yes, so the links are in the chat. Please RSVP for the future events. I'm going to ask this question. Anyone that is available to stay can stay and receive the answer. We did receive a question in registration regarding someone who is a parent trying to relate to their supervisor who is not a parent, the different type of parent-related struggles that they are experiencing, but their supervisor is not receptive. So any advice to that parent and other parents on ways that they can get this message across to their supervisor and how they should interact with their supervisor if their supervisor is not receptive?
I mean, I can give a little, and Deb, you probably have good advice on this too, but I would say if they're not receptive, usually the HR business partner or HR generalist can give ways to have that conversation. And also if you have an employee assistance program, working with that EAP to get ideas on how to have that conversation.
I was just going to say our EAP is terrific, both at working with supervisors and employees to help navigate some of that. It's also helpful to talk to friends and colleagues that are not at work to help you think through what you should be asking for. Because sometimes if you just come in with the problem and no ideas of solution and somebody's not receptive, they're not going to be creative and helpful. But if you come in with, here's the problem, here's some ideas I have, potentially that could be helpful as well. And again, I'll always go back to your union counterparts, where there's a union can certainly be helpful as well. Not to be combative, but rather collaboratively work through the problem.
Yeah, I was going to add one more resource if it gets to this extent. Obviously, kind of enforcement action is the last lane you want to go down. But you know, quite often when I was at the mayor's office for people with disabilities, we get these inbound requests. How do we advocate to our supervisor? And when it gets to a case where we realize, hey, we can't really support here with advice or guidance, it's really leaning more toward legal guidance that might be needed, we immediately make a referral directly to the city's Commission on Human Rights. They're a great group that helps folks to really, before they get involved, the Commission on Human Rights gets involved, helps individuals to understand what actions they can take on their own to preserve a strong relationship with that supervisor and employer before engaging, you know, the Commission on Human Rights to come in and really lean on that agency to hopefully, turn things around through some form of enforcement action or, arbitration.
You know, I'll just add that while it's great, I think the strategy you mentioned, Deborah, about coming in with your issue and potential solutions is a great approach. And then, of course, that has to be partnered with education and training for the managers, who all of the responsibility, of course, cannot fall to the employee, right? So we need to be sure that our managers and supervisors are educated around having these conversations and being open-minded and supportive to the variety of needs that our employees will have, including parents.
All right, so I appreciate you all staying a little extra to answer that question. And thank you, panelists and Nance, for that great response and for this great panel as a whole, all the great ideas and resources that you all noted and mentioned. I did take notes and jotted down some of these resources. We will be sharing the slide. The recording will go up on Parent University. It will probably be available on our website as well. Again, we have 2 additional workshops coming up, one next week, one the week after. Next week is for parents. The one after is for teens. And so how do we support our teens' mental health? And so for teens and parents. So definitely hit the link and register for that. Thank you all for your time today. And hopefully everyone has a great afternoon and is staying warm because it is November.